Well, great. First of all, good afternoon, everyone. We're about to enter the next stage in our fight against COVID-19. We heard from General Hillier yesterday on the status of the vaccination plan, and we will hear more from the General just in a moment. But I wanted to say how grateful we are as a province for all the support that you've shown out there, the hospitals, frontline healthcare workers, the public health units, everyone that's involved. We're so grateful. In executing what is the most comprehensive vaccine rollout plan in the entire country, this provincial plan is being tailored to the unique populations and geography in each of our 34 public health units. To execute this plan, we pulled together healthcare experts, business leaders, and frontline workers in every corner of our province. We will also be relying on an army of volunteers to help make appointments, drive people to the vaccination sites, or simply encourage a loved one to get their shots. And every single person has a role to play. This will truly be a Team Ontario effort, as it has been right from day one. But I'm confident we have counted on this team since the beginning, and they've never, ever let us down. We're seeing the light at the end of the tunnel, and I'm told that due to the vaccinations in our long-term care homes, more than 350 lives have already been saved. And we don't have the supply that we need right now by a long shot, but when the shipments do arrive, I can assure you we will all be ready. And I want to thank you again for your efforts and the great work that each and every one of you are doing. Now I'll pass it over to General Hillier.
Thank you, General. Premier, thank you, and thank you for the remarks. Well, medical officers of health and CEOs of hospitals, thank you for being here today, and thank you for all the work that you do. The title for this meeting, the credo for us going forward, is really simple. Needles in arms. We want needles in arms. We want the vaccines in those needles going into the arms of the people of Ontario that we want to give a level of protection to that they simply do not have right now. We want needles in arms. And in this meeting today, we're going to talk about how we do that. We are going to talk about going through the priorities concurrently, not sequentially, to make it faster and more efficient. And we're going to talk about doing things that we've planned for and just haven't had the vaccines to get to, but now we do. And that means that this coming week, we're going to be able to allocate to the Indigenous adults in the prioritized at-risk communities, building on all the great work that Deputy Batiste has done with his table, and we're going to be able to allocate to them, starting this coming week, 10,000 doses a week till we finish off that priority. These are the communities in vulnerable circumstances, higher risk communities, and we've been planning for it for a while, and now we're actually going to start doing it. Thirdly, we're also going to talk about being able to respond to hotspots or outbreaks. And in this case, we're going to respond to the outbreak in the homeless shelter here in Toronto. I've talked already to several of the CEOs, and we'll talk about it today, how we can do that, how much vaccine we would need, and then how quickly we can actually provide that level of protection to a group of people who desperately need something. That's going to be the aim of our meeting here this afternoon. I thank you for being on the call. And needles in arms is what we're going to discuss.